Hi, this is Curtis Alexander. I'm a pharmacist. In today's video, I want to talk about the side effects of gabapentin. And in particular, I want to talk about what I would consider what I find to be the most common side effects, not necessarily everyone you could potentially see. So let's hop right into it. First of all, I like to pay a little attention to MOA's mechanism of action. Let's look at how we think gabapentin works in the body. That will make more sense as to what side effects you may possibly see from it. So first of all, we don't really know for sure exactly what it does. We believe what it does is that it can modulate excitatory neurotransmitters. So you have these chemicals floating around that can essentially excite neurons, and you can see that particularly in people with seizures and some of those things, which is one of the reasons we use gabapentin. Not as much anymore, but in the past it was used for that more so. So when you have excitatory transmitters maybe being modulated and controlled, it makes a little more sense on some of the side effects. So I'm going to cover the 5 most common. I think that's the most important for you to know. So first of all, we see dizziness. This is the one I tend to see the most. We're going to look at 17 to 28% of folks will complain of dizziness, and it's much higher in the IR formulation. IR is immediate release versus ER, the extended release. We see that at 11%. Why higher in immediate release? Because you're dumping more drug into the system quicker versus an extended release tablet. You know, if we're looking at it over the course of the day, it's more level, rises more level, versus something that's immediate release will have more troughs and valleys. So, or excuse me, peaks and valleys. Next thing we'll see is some drowsiness. Again, think about that excitatory neurotransmitters we were talking about. Immediate release, around 20% of people. Extended release, around 5%. Fatigue, again, we're looking at immediate release, 11%. This one is interesting. They did notice that in kids, they saw an increase in viral infections. One of the theories behind that, one of the theories behind that is they studied this in kids who had epilepsy, who sometimes those kids are just sicker overall, and so they postulate they were kind of guessing that may be contributing to the increase they saw in viral infections. Based off the mechanism of action, it wouldn't make total sense to see that, but it is something to keep an eye out for. And then we have asthenia, which is basically physical weakness, a lack of energy. It kind of comes back to this fatigue, I would say. But again, immediate release, we see 6% incidence. So the big takeaway with gabapentin, you're most likely going to see drowsiness, dizziness, fatigue. Those are the big 3 things to watch out for. If you have any questions, post them in the comments. I do my best to look at those comments, answer them if I can. I don't always have the time to answer all of them. And if you have other ideas for videos you'd like me to cover, let me know. So I hope this video was helpful. It was a quick one, but kind of covers one of those big drugs that we see a lot and some of the more common side effects. So until the next video, again, this is Curtis Alexander, and I hope this was helpful to you. Thanks.